Welcome to the first ever dot.LA virtual pitch showcase. My name is Sam Adams. I'm the co-founder and CEO of dot.LA, and I wanted to thank you all for joining. For those who don't know, dot.LA is a new news and events service focusing on the Los Angeles tech and startup community. We aim to shine a light on all of the great entrepreneurship and innovation that's happening in LA. And one of the ways that we are planning to do it is by hosting these virtual pitch showcases where we get some of the most exciting entrepreneurs in the city to pitch their companies to some of the most influential investors in the city. And so we are really proud to have our first version of this time, focusing on 3 companies that are doing things that are particularly interesting and necessary in the current COVID crisis. Obviously, we plan to do these future ones of these in person, but in the meantime, we are trying these out as our virtual event series. So without further ado, I will introduce first our judges. We have dot.LA's co-founder and executive chairman, Spencer Raskoff.
Hi.
And Anna Barber of Techstars LA and The Fund. So we are really excited to have both Spencer and Anna, who are 2 of the most active and respected investors in the city, to discuss with the entrepreneurs that we have selected today, their companies and all of that. So without further ado, I will introduce our entrepreneurs. One housekeeping note that I will say is we will be taking audience questions. So if you want to use the chat function, we will keep an eye on that and give you the opportunity to submit questions to the entrepreneurs. The format will be 5 minutes of presentation and then 5 minutes of discussion. We have 3 companies going today. The goal of this is not just to pitch for investment, although that very much is part of the goal, but also to have an opportunity to share the ideas that are happening and find any way that we can to support all of these entrepreneurs that are doing such interesting and important work. So the 3 companies that we will have are Bentley Adams from Mealshare, which is an app that connects nutritionists to people. He'll explain it better than I can. Celine Tien from Flowly, which is a service that works on chronic pain and illness. And Dr. Nana Afomanen who is an ER doctor who is actually coming to us straight from the front lines and works on a service called Shared Harvest Fund and an app that will specifically help with the COVID response. So without further ado, I'd like to introduce our first panelist, or our first presenter, Bentley Adams. Bentley, take it away.
Great. Thanks, Sam. Let me get this loaded up here on the share. There we go. Okay, perfect. Well, thank you again for having us here, and hope you and everyone on the call is staying healthy and safe from this virus and staying happy in quarantine. With me is Meg Shedding, an advisor of ours who will be moving into a product role as we move forward. But we're going to present Mealshare for its core attributes and speak to how we are uniquely aligned to help with both sides of our business during this rare quarantine period. Like you said, 5 minutes is very short, so hopefully this gives everyone a good overview to start the conversation. So the story and mission of Mealshare really starts when I was in college at UC Santa Barbara. Having grown up in Southern California, this bubble of health and wellness, and also being an Eagle Scout raised in a family with 2 World War II veterans, I have a deep love of our country. So when my mentor told me that 2/3 of people in this country were going to live a life of pain and suffering due to preventable chronic conditions, it hit a chord deep in my soul, and I knew that that was my calling to impact health. After spending years on the corporate and entrepreneurial sides of healthcare, it became clear the solution needed to be nutrition, and it has to be solved with people directly in their daily lives. It won't be solved through the healthcare system itself. And when we look at why people struggle to eat healthy, we can distill it down to a few key problems. First is access to the right information. 77% to 92% of all online health searches start at the search engine, primarily Google. But whereas other areas of search produce 95% satisfaction or more, nutrition question search produces only 10% satisfaction. At the same time, forums, blogs, and social media are chock full of misinformation, which is not only not helpful, but it breeds a lack of trust. And possibly the worst problem of all is that per a broad compilation study by UCLA, 83% of quote unquote diets fail, leaving people worse off than when they started. And that's mostly because a diet, it really isn't natural. And so it's not sustainable. Enter MealShare, a mindful eating app that connects consumers to nutritionists who are all registered dietitians, producing a 90.1% satisfaction rate and giving clients actionable, vetted information from real pros, and creating a community in our sharing feed where a flywheel clearly exists, as shown last year during our active marketing. We had over 20,000 share ratings from just 635 clients. So we know that more users creates more engagement. And despite all of this being on a V1 product, we were elated to see a 21% retention rate at 6 months on our subscription services, compared to an industry average of 15% at 1 month. The way it works is really 3 pillars of activity, wrapped in a lightweight, familiar user experience. First is listening to the body. This is simply creating awareness through 3 points of mindfulness. 1, snapping pics of what you eat. 2, writing why you chose to eat it and any nutrition questions you have for your pro. And then 3, self-rating it on our positive psychology-oriented support bar. The second pillar of the experience is the share feed, where people rate each other's meals and mindfulness activities on the positive support bar. And this is where we saw that flywheel of activity. More users created more engagement. And the third pillar is the connection with the pro. We saw last year that 82.9% of clients said they wanted to direct chat with their pro without having to snap a picture first. So that's what we developed. Ensuring, again, better support and higher quality of information goes back into the flywheel of engagement, especially as we grow in this seed round. And the beauty of all of this is that we're fully digital. So people can do these steps in the comfort of their own home and do it. And it gives them something positive to do for self-improvement during the quarantine that will likely last past this month and further into the spring. From the B2C side, the model is simple. We charge a per month subscription on an easy access $9.99 per month plan, starter plan, and a $39.99 per month plan for unlimited pro messaging. The only differences are really the starter plan is only good for 100 total pro messages and has fewer pro reviews. Our goal with seed funding is to get to 30,000 starter clients and 10,000 unlimited clients, priming the path to the development of an AI that allows us to access a broader population with a higher margin. And so we can not only build out our mission, but also build out the business. As well, we've organically developed the B2B side of the business, which started with helping Perennial Nutrition formulate their V2 product by leveraging our dietitian network. And now we just expanded to help them with their pilot with CVS next month. And with Zipongo, they're building a whole new telenutrition service line with their health plan clients around our dietitian network. We're really focused on getting health plans to cover copays to telenutrition during this quarantine period so that we can expand our reach and ability to help people during this difficult and rare time. We believe this B2B business will also help us get to profitability and helping cash flow the B2C side to the business as well. We are raising right now. Our ask is for $1.5 million to tailor the app experience to our core demographic of moms, drive acquisition to get an even higher level of growth from the flywheel, generating 40,000 total clients. Also, we want to get to a $1 million run rate with the B2B side of the business, and our projected valuation just from the B2C side of the business at 10x the 4.3 million of net ARR we project is $43 million. And that's it. Thank you so much for your time and for the opportunity to present here. and I look forward to hearing all the questions.
Awesome. Thank you very much, Bentley. Anna and Spencer, take it away.
Go ahead.
Go ahead, Anna.
Thanks, Bentley. Great to see you. Really interesting product. I'd be curious, how are people using MealShare right now, during social distancing? What are you seeing? How has use changed in this time versus what you saw before?
Yeah, it's a great question. So I think during the quarantine, what we're seeing and what we're really promoting through social media and just through our network with existing users is helping people to use the time to get more aware of all the influences that go into how they eat. It's a rare time. People are at home. They're mostly stuck at home. And so what we're really looking at and what we're seeing is people talking about how their sleep affects what they eat, how their stress levels affect what they eat, how their kids and their dynamic in their family affects what they eat. And so really that's where we wanted to create more consciousness around that, because long-term, we believe that sustainability of healthy eating comes from developing lifestyle healthy eating, something that's attached to who you are and all the elements in your life. So that's really what we're seeing and what we're focused on.
Great. And just one follow-up question so I can kind of understand who the core user is and how they're using it. Is it, $9.99 and then $39.99? $39.99 feels like a relatively high price point. So are those super users, are they seeing this more as coaching? Are they looking more for advice or more for coaching? What does the use case look like for those super users?
Yeah, so they're using it as consistent coaching, and really what we've done and what they're using it for, it actually wasn't what we positioned it as, it's what the clients told us that they wanted to use it as, was a replacement for Google. So instead of asking your questions into Google, you're asking an actual pro, getting personalized information back from them. But from a price point standpoint, it's a good point too. When we look relative in the market to get a nutritionist, you're talking about $150 to $200 minimum to engage with the pro. So we're very careful to position that. And right now we're still in a relatively unscalable phase and looking for the future where we can scale that out, driving home that point of the price point parity to a much more expensive service. But you get much higher value being in, through your phone in the comfort of your own home. So that's kind of how we're addressing both of those and how the use cases work, if that makes sense.
So Bentley, I had a couple of comments and some questions. First comment, I love seeing startups where the founder has a personal connection to the mission. Clearly, this is something that you care deeply about, and that's critical. I love seeing mission-oriented companies, and clearly this is. And I also like, again, just focusing on founder fit for a second, I like that you've done some stuff. You didn't really have time to expand on what you'd done, but clearly you'd sort of kicked around in and around this industry for at least a couple of years doing different things. And I'm sure you learned a lot. And if we had more time, we could expand on that. But that's like really good founder profile relative to this specific problem.
Thank you.
The other comment is it reminds me a little bit of Noom, which seems to have really reached escape velocity and has raised a ton of money from Sequoia and others. And it's sort of like a disruptive Weight Watchers kind of personal coaching for weight loss. Maybe there's some similarities or not, but just advice as you're pitching others, you might have a slide that's a competitive map that sort of explains how MealShare fits into the overall competitive landscape. My question for you is, this is a two-sided marketplace. You have supply and demand, right? You've got supply of nutritionists and demand for them. And so usually in these two-sided marketplaces, it's harder to acquire either one side, either the supply or the demand. So which is harder for you to acquire, and what are one or two tactics that you're focused on, either on demand generation or supply generation?
Yeah, so definitely, like you said, I think I love that you have a clear awareness of this, having built a two-sided marketplace before as well. The easier side for us has always been the dietitians. We actually tried to go B2B2C for a while. We had more dietitians engage with us than ever before through the academy. We broke all the records that they had. But on the client side, on the consumer side, like you mentioned, Noom, there's a lot of noise. I think that's generally where we put Noom kind of out there is they're really trying to beat Weight Watchers. It's a totally different game, and it's a paywall game, which we're not. We have a free app predominantly as well. But I think it's the big challenges and the big tactics, I guess, that were the main things that we've been doing to go through that. We iterated through, my background, I guess, in digital marketing helped this out a little bit. We iterated through doing partnership affiliate deals through Facebook paid ads, Instagram paid ads. Then we found this niche with not even mid-micro influencers on Instagram, but with nano influencers on Instagram. And that before that's recently gotten saturated. We had over 600 nano influencers respond out of 2,943 that we reached out to. So we knew that our mission and our method really resonated with them, and they were willing to work with us on a really, really low cost basis for us. So still we need to do some work on that, but I think that we found that there's clearly a lot of people out there, over 20% of people that we even reached out to responded and really felt strongly that they would be able to help us. And so we activated with 300 of them last year, and each one of them on average brought us 5 clients. So that was a start. We have bigger goals for that program this year, but that's really how we've figured out tactically to get the grassroots effort into the market, into the consumer market, and try to overcome that obstacle.
And can you talk about the market size? Like, what is the total addressable market? How do you define TAM here?
Yeah, so TAM, it's really hard. It's a good question because so globally, TAM, is the healthy eating market. It's massive. It's $647 billion. Now, in the US, it's about 270 billion of that. But when you look at, specifically our demographic of not just moms, but health engaged consumer, ultra or core health engaged consumer moms, from all the data we can find, the broad marketplace is $46 million, but for the ultra and core engaged in healthy eating, it's about 8.7 billion. So that's really, again, it's very hard because the data isn't really good in the connected marketplace. You can look at a mindful marketplace, which is about $2 billion marketplace. You can look at connected services on the consumer side in nutrition, which is about another $2 to $3 billion marketplace. It's hard to tell, but then at the same time, you have meal kit delivery companies, what's the buy decision based on there? So we're always trying to look at how do we define the market a lot better, the serviceable market and the TAM. But that's kind of our best guess right now.
So you break down your 4.3 million target revenue. There's 3 buckets of revenue in there, right? The sort of lower tier price point, the higher tier, and then the marketplace. Can you talk a little bit about kind of where you are with the marketplace and with bringing in referral fees and product partners?
Yeah. So I define it a little bit differently. So the 4.3 million, and I think I'd mentioned it during the presentation, but the 4.3 million is solely based upon the consumer side of the market, or the consumer side of the business, right? So it's just the $9.99 and $39.99 per month plans at getting to 30,000 clients on the starter package side, and then 10,000 clients on the unlimited side. So on the B2B, this is kind of our progress. We were actually about to roll out the service, like with these services on the left side of the slide, the survey, the credibility, the promotion services. That's what we developed around our anchor client with Perennial. And we were going to roll it out to natural foods companies at Expo West, but Expo West got canceled. So we've just been basically expanding with Perennial. We signed the agreement with Zipongo to help people with telenutrition.
I'm sorry, I just want to interrupt you. I don't totally understand this side of the business. I think what I'm hearing is like, you have this network of nutritionists, and so now companies that are trying to market to them or use them in some way are coming to you to connect with the nutritionists. Is that what this is?
Yeah, so basically, if you're a natural foods company, what you're trying to do is develop a product, right? You're developing a beverage. So for example, Perennial is a plant-based nutrition beverage for the aging population, right? So they had their V1 product, and they wanted to get that and message test their marketing, make sure that it was accurate in the dietitian's eyes. And then, so that's what they're using surveys for. So they're surveying the dietitians, sending them product and doing that. They're also doing credibility testing, right? So the one-on-one or focus group sessions with the dietitians. So again, going back to my agency background, this starts to look more like an agency style business. That's why it's not core. Then now what we're finally getting into with Perennial, going through the third type of service that we developed is promotion, right? So actually using the dietitians out in the field with their pilot with CVS in Massachusetts and Rhode Island to activate our dietitians and help drive clients into the stores.
So just some feedback for you and for others watching this. I'm sure you're a very small resource strapped startup, like most.
Always.
Right. Okay. So it seems to me like you have at least 3 things going on, 2 on the B2C side and 1 on the B2B. On the B2C side, it's a way for me to message with a nutritionist, pay to connect with a nutritionist, which would have been much more expensive if it was a one-on-one, but this through scale and technology, it's $10 a month to message nutritionists. Then there's also the kind of meal sharing thing, which is like, hey, support network of friends, help me eat better by telling me that I'm eating too many carbs or too many sugars or whatever. Those are kind of could be different apps, different features potentially on the B2C side. And then on the B2B side, you've got this other business that you just described. It seems to me to be pretty hard to find the resources to fund all three of those initiatives, and there are probably others that you haven't even gotten to. So you might, at least as you get to say Series A or Series B, you might focus on one or the other.
Yeah. I mean, that's kind of where I was going with this too. I agree with that point. And I think, you're framing it in the slide as de-risking profitability, but like, to me, your core business seems really solid. And so just kind of doubling down on that. And you also described this as, it's almost like a quasi consulting business about, helping these companies with their product launches, right? And it feels like super high value for them, but maybe for you and for what you're trying to build, it's a little bit pulling your team off focus.
Yeah, no, I appreciate that. And that's a fair point. And I've always focused, up until recently on just doing the B2C business. So, kind of with Spencer's description of the B2C business, we've really tried to, as I was describing that before, the three pillars of the experience, make that into a lightweight, familiar user experience. So it all seems cohesive when you're in the app. So it doesn't feel like it's too many things, but at the same time, I do see that there's a free app and then there is a paid part of the app, and that requires effort on our team side in order to do that. On the B2C side, and I've always worried about this, and actually it was only until recently when I was, the Zapongo deal came up during last year, and then the Perennial deal, they wanted to expand, that we're like, we had a lot of investors that not only our investors, but other investors said, you should do this definitely, like 100%. And so we get mixed feedback on, is this good or is this distracting, right? Yeah. And I definitely see the distracting. I would prefer, all things being equal, to just do the consumer side of the business. That's where our mission is. That's where the impact, I think, ultimately is. But if we can also help other companies and help the ecosystem and, help people get access to telenutrition in a scalable format that produces profit, that's why I was open to starting that side.
Yeah, we're going to have to wrap up and move on.
Yeah, that's great. Thank you. Yeah, thank you so much, Bentley. Appreciate that. We just want to make sure that everyone gets a good amount of time, but that was a great discussion. I think that was feedback. There were some great questions that unfortunately we didn't, from the audience, that we didn't get a chance to do, but if I can reiterate, we will also follow up with contact information with the entrepreneurs. And so if your question doesn't get answered now, there will be an opportunity to do so later. All right, next up, we have Celine Tien from Flowly. Take it away, Celine.
Thanks. Let me share my screen. Cool. Can everybody see that?
Yes.
Awesome. So my name is Celine. I'm the founder of Flowly. We're a mobile app for chronic pain and anxiety management. So let's say you had pain today. You wouldn't be alone. 100 million Americans suffer from chronic pain. That's a huge amount of people in the US, 1 in 3 people. And what's worse, when you have chronic pain, you'd feel the physical pain. So, all the bearings of chronic pain, your back, your knees, all those nociceptive nerves, but then you'd also feel the mental pain. The number one symptom of chronic pain is actually anxiety and depression, which is why we frame a lot of what we do as both pain and anxiety management. The third thing that I don't think a lot of people bring up is that when you have pain and when you have anxiety, it's hard to get out of bed in the morning. It's hard to go to work. Some people are on disability. It's hard to even socialize and have parties, hang out with family and friends. So a lot of people in this population feel very isolated. That's not even adding the layer of today's context, right? With COVID-19, the American Psychiatric Association reported high levels in anxiety in 50% of American adults today. And plus everyone, you should be socially isolated. So we bring Flowly to the table. Flowly is an app that offers interactive experiences that train you to relax by teaching you how to control your nervous system. So we utilize your phone camera. You put your finger on the back of your phone camera, and we're able to get your heart rate, your respiration, different bio and data points that we actually show you in real time. So you're able to track how your body's doing as you're learning to relax, which teaches you to turn off your fight or flight mode and turn on your rest and recovery system, so your parasympathetic system. All 8 sessions of our introduction sessions are available to anybody who downloads the app. And then once you subscribe, we actually send you a low-cost virtual reality headset. Simply you slip your phone into it, And you're able to do all of these trainings while immersed in VR. So you'll literally be on the beach with aurora lights above you. You'll be by the forest, a mountainscape, any kind of world you can imagine. You do these gamified experiences in while learning to control your nervous system. We're also releasing a community feature where users can share resources with one another, even play with and against each other in these experiences. This makes us the first biopsychosocial platform for chronic pain management, focusing not just on the physical pain management, but on the mental one and a social one. So I founded this company because my whole family's in biotech. My father was a head of neuroradiology at Duke. And when I was growing up, the first 15 years of my life, they were running pancreatic cancer clinical trials. I hope no one has experience with it, but if you do, you'll know that in its terminal stages, it's extremely painful. It's so painful that a lot of people actually pass away from morphine overdose and not the cancer itself. So pain management is very, very much part of how I grew up, something we talked a lot about, my parents worked on. And later on, when my team and I, we were working in interactive media, interactive content, and VR and AR, we realized that there had been literally decades of studies using this for pain and anxiety management. So it was kind of a no-brainer for us. My co-founders and I, me, Julian Soros, Naray Kim, we have combined engineering, development, design experiences from DreamWorks, Hyperloop One, Yale, and California Institute of the Arts. We work with a world-class set of advisors from UCLA, UPMC, etc. But we also were just awarded a $1.2 million grant from the NIH. We're also partnered with the University of Pittsburgh Medical Center and USC here in LA. We launched a closed beta 4 weeks ago. We have a 19% conversion from download to paid subscriber. And when COVID hit, however, we saw an even more increase in searches for our product, engagement with our product, and people asking us, hey, can you take this out of beta so I can use it because I'm suffering a lot from my pain right now, my anxiety right now. So we're proud to announce that as of last week, we partnered with Global Giving. For every and all sessions completed in Flowly right now, we'll be donating 50 cents to their COVID relief fund. So this is literally medical supplies going to the front lines, sending doctors and nurses to affected communities, meals for families and children in need, and even care for the elderly. We also released a special 5-minute experience that anybody can access on our app that is designed specifically for COVID-19 anxiety relief. So we have 2 asks. One is that we're raising a pre-seed round. It's a 1 million round. We have 300K closed as of last week. And we're looking to talk to early stage investors, angels, early stage funds. Reach out to us if you have interest or have questions. The second more important thing is share Flowly. So Flowly is built on the mission of making health, pain management, anxiety management super accessible to anybody that suffers from it. By sharing this, you don't know who you could affect. People are struggling now more than ever. We also released a web app version right now on our website. If you go on www.flowly.world, you'll be able to try a 5-minute experience of our COVID special feature that you can get a taste of what Flowly is like, and then you can download so that we can donate 50 cents on your behalf. Reach out to us with any questions you might have. But my name is Celine, and this is Flowly.
Wonderful. Thank you, Celine. Spencer, Nana?
Should I go first, or you want to go first this time? Or
I'll go because I've seen this team. So Celine, it's great to see you. I was just
Hi, Anna.
in my email as you were talking to see when the first time I spoke to you guys was in 2018. So it's been 2 years. So, you know, I love to see teams care deeply about a problem and kind of work it from different angles for a long time. And you've come a long way since then. I love the focus. I think one really interesting thing about your business is that just in the last few months, we've gotten to the point where, you know, VR we're starting to see real signs of sustainable businesses built kind of on VR, right? And I think for a long time, VR was something that we felt was coming out in the future and it wasn't really here yet. And I now, just in the last few months, even before, you know, we went into social isolation, I've seen many companies with kind of a VR business model that are actually making meaningful revenue. So I think, you know, it may be a great time for this. I guess my questions are really about, you know, pain management versus anxiety management is kind of a question, you know. So one thing that I noted is that, you're defining this kind of really broadly, and I'd like to understand more about, the solution and which piece you're actually focused on. And then, related to VR, I love what you're talking about of using the camera to kind of get biofeedback data. I think that's super interesting. And is it possible for someone to use and access your product without actually having a VR headset, or is it required, in order to get the full benefit that people have VR?
Yeah, so great question. We are releasing a tiered subscription in the next 2 weeks, such that you can subscribe for a lower cost without using the VR headset. So you can do all the biofeedback, interactive experiences just on your phone, like you said. And I think this touches on your first question, because I think this tiered subscription answers this population that is more generalized anxiety and that don't require the sort of the full immersion of virtual reality to distract from severe chronic pain. Now, our first mission, our first focus is on a chronic pain population because it's 100 million Americans and they are in desperate need of a solution right now. There's this huge white space where the healthcare system hasn't fulfilled the need to allow access to all these people to viable pain management. They've taken away opioid use. Wait list to get into a pain management clinic is 6 months to a year. And there's not a lot of solutions out there for them. So people are paying just hundreds of dollars out of pocket every month on fragmented solutions. To give you an idea, the market right now is $15 billion out of pocket every single year on just alternative pain management. So that doesn't even include over-the-counter Advil or Tylenol, which is insane. So this is really the market that we are beachheading. We're focused on. We're partnered with the U.S. Pain Foundation, some of the largest patient advocacy groups for pain. And the reason why we've decided that anxiety is something that we're also taking on slowly is because when you work with pain patients, they'll know it's one and the same. Anxiety and pain, they're a perpetual negative cycle, and you have to address both, which is why I think it's important we address both the physical pain, but also the mental pain, because that's a lot of what drives more drug use, more dependency on hard issues around pain management, and not being able to sleep through the night, things like that.
So just kind of going through my notes, I think you did a great job demonstrating the huge addressable market. There's no question that it's very large. The credentials of you and your team are impressive. I agree with Anna that being able to put your finger on the camera, that certainly got my attention. I actually think that slide, but then you meet Flowly. I usually don't give feedback on specific slides in decks, but I actually think that that you said a lot. There's a lot of information, a lot of impressive information on that slide, and that slide actually didn't support it well enough. So you should have put a short video in there showing how the camera actually reads it. A couple, a photograph of what you see inside the VR headset. Unfortunately, a lot of angels and early stage investors are skimming these decks, on DocSend or wherever else without hearing the voiceover from the founder. So I just sort of beefing up that part of the pitch I thought would be helpful.
We can send you, we have more detailed decks. We'll send individually.
Cool. And then you should be commended for being so nimble as to roll out quickly a COVID-19 kind of feature, both to seem both to help the world, but also to seem responsive and seem kind of not just focused on what's happening in around us. The statistic that got my attention the most was 19% conversion from free download to a paid sub. If that metric holds, that's really interesting. That will give you very attractive, CAC LTV metrics, and could allow you, once you're done figuring out how to growth hack your way to break even, it could give a Series A investor confidence that if they started doing paid marketing, that then it would pay out, pretty quickly. So I guess just more information about that is interesting. One thing I do worry about is sometimes those metrics look really good for the early adopters, because of course somebody who is so interested to seek out an unknown product in the App Store or wherever else and download it, 1 in 5 of them are going to convert, but the 3 millionth person that downloads it, a year from now maybe isn't as highly qualified, and so the metrics don't hold, and so investors have to be careful about something like that. I guess, can you just talk about the competitive landscape for a moment also, how you fit into other competitors?
Yeah. So I'll answer that by answering a question I think that is often thrown at us, which is, do we see ourselves as competitors with companies like Headspace or Calm, right? So other meditation apps. And our answer to that is no. We don't compete with more low-cost subscriptions that are focused on a generalized wellness and anxiety population, just because there's a few things about our product that differentiate us very much from general meditation apps. One is that we're very data focused. There's a data play here in the back end as well that I'm happy to share individually, where we're collecting a lot of valuable information about how people are behaving around pain, anxiety, interaction with the app, but even their literal biological data, right? And so we're able to model out behaviors, model out the system and software such that it can be predictive of pain and anxiety attacks, not just reactive to them. The second thing is that our focus on this population of clinically impacted patients gives us a much easier leeway into working with these users and accessing them. You were saying that 19% conversion is impressive in the early stages. It's hard to maintain that later on. I agree with you. And that's one of the reasons why we feel comfortable and confident in working with a severely impacted chronic pain population. Because when you work with them, you know that that's the only thing they think about is their pain, and they're willing to spend out of pocket. They're willing to put in the time to do things to alleviate it. And they're also highly associated with big patient advocacy groups, clinic referrals that we already have access and partnerships with that give us a free and easy access to this population. So we're not competing in digital marketing. We're not competing on branding and being the next meditation app. We're really a data-focused company providing a real solution for people that do suffer from chronic pain and anxiety. And plus, if you work with chronic pain patients, you ask them, have you tried meditation apps? And 99% of them will say, yes, we have. It doesn't work. Why? Because when you ask someone to close their eyes and focus in on their body, well, that's where their pain is. This is kind of like an externalized meditation where you get the benefits of breathing, of relaxation training, of mindfulness, but you're focusing on external stimuli. You're focusing on an interactive experience. You're focusing on VR. You're focusing on your phone.
Is there anything patentable about the either the products, either the VR piece or the biofeedback on the camera?
Yeah, so we have a patent pending on the design on the part of our software, and I'm happy to share more about that individually.
Cool.
And I just wanted to hop in. There's an interesting audience question that, I thought we could maybe close on it to be sensitive of time. They say, sounds like you're framing this to solve medical concerns. Do you have any blinded outcome data to prove efficacy as opposed to general studies about meditation, but specific to your solution?
Cool. Yeah, so our solution basically takes two therapies that have been used and validated for decades. One is VR for pain management. The second is biofeedback for pain management. So there's actually hundreds of white papers of studies using both for this specific application. We were easily able to work with the chair of anesthesiology of UCLA early on because this is something that doctors all recognize are used in practice today. Essentially, we're just making two expensive and traditionally inaccessible therapies accessible. We're making them available on your phone. You could do them 5 to 10 minutes a day, and a lot of our users will use it, right before they go to bed or on their couches in the morning. But to answer that even more is that with our NIH grant, we're partnered with UPMC and USC to conduct clinical trials that are 2 phases. They're controlled 3 arms, and they're basically ready to go after quarantine is over.
Wonderful. Yeah, that was great and super interesting. Thank you very much, Celine. And now we turn to our final presenter. She's been really kind to share her time with us right now because she has been literally on the front lines of the COVID crisis and is moonlighting with a separate project to help. So we should all really thank her for taking the time to join us. But it's Dr. Nana Afomanen.
Hi, thank you. Thank you for inviting me. I'm gonna set my share screen here, I guess. And all right, and do all the funny things that get the screen out of the way. Is everybody okay with what they see?
Yeah.
I can just say,
Good.
make it bigger. Okay. So I'd like to tell you about my COVID MD. It's something that's real near and dear to me because of what I'm seeing on the front line. It was one of those product market fits where you see the problem and realize that you're the only one that cares enough to step out. And then as soon as you step out, you find so many other people who care as well. So it's been emotionally liberating to be a part of this journey. So my COVID MD is about understanding that there's 44 million people in our country that are falling outside a medical safety net. And in times of crisis, it gets larger and paramount. This includes millennials who are starting startups and are underinsured, as well as the uninsured, the homeless populations, and our immigrant population. And so when we talk about we need to move from the me to the we in the society, we have to remind ourselves that we are not just those who are uncomfortable being self-quarantined. It has to be the we that has been marginalized even before this period. So one of the very common statements you always hear is when America catches a cold, Black America catches pneumonia. And in the last week or so, you've been hearing advertisements of the number of deaths associated with COVID-19 markedly higher in the African American and Latino community. Has a lot of association with chronic disease, but it also has association with the isolation period and how much these communities are dependent and reliant on social services that now have been displaced and dilapidated. So the problem, as we see it, Shared Harvest Fund has always been focused on 3 pillars: wellness, service, and relief. And the problem in this scope of the coronavirus is physical isolation impacts wellness for populations who are at risk. In terms of access to services, these individuals who rely on the emergency department as their primary medical home are no longer able to activate it. And in terms of relief, our free family clinics are now closed down, and emergency savings that these families and communities have are non-existent. Our solution is our power team is the My COVID MD app, where we believe that it is designed to get free telemedicine testing and services in the social service sector to marginalized communities in real time by real people. The way we plan to do that is we're the bridging gap to rapid decentralized testing. Right now, all the testing is being funneled through the hospitals. Very few places are testing outside the hospitals. And if you only get tested if you are insured. Through our app, we are able to identify 3 ways to access testing. Also build crisis buddies, which are partners for anyone who is a client within our app. And then the most important thing is our community health partners program, which we connect them to our contracted telehealth programs. Through the initiative, we plan to deliver 10,000 rapid testing, antibody testing, which is critically important to identify who has immunity and can then go back into the workforce to support our social services. We want to deliver 50,000 or more live video telemedicine as well as telewellness services through our app. And we are planning to scale up our pop-up services. I've talked a little bit about myself, but the reason why I took this pivot from Shared Harvest Fund, which is focused on bridging skills-based volunteers to the nonprofits who need them the most and supporting them with student debt relief, because I've always believed in the vision of having a citizen-based volunteer corps for a crisis just like this. So far, we've had 250 tests done, 3,500 registered volunteers, and 7 sponsors. We, in the last 2 weeks alone, has expanded our reach and service. We are going to be now expanding into Queens and Detroit, which are impacted the most. Our revenue model includes focusing on contracts within cities and private entities and donors as well. And our revenue stream is focused on the testing itself, one-on-one. If you have insurance or want to test yourself, you pay the highest premium rate, and that allows us to offer free testing on our sites. What do we know about what we're going to make out of this? We don't know. We're focused on doing the good and hoping that that will sustain everything else. These are our partners. And in terms of our ask specifically is that we are asking for $250,000 to focus on 3 things: economic development, building our antibody test kits, and deploying the app faster so we can reach more people. This is the way you can reach us. We have a GoFundMe page. We also have our normal site that you can, and then follow us and see where our pop-ups are. Thank you.
Awesome. Thank you so much, Dr. Nana. Really, really appreciate that, and really amazing stuff you guys are doing. Spencer and Nana?
Yes, so thank you, first of all. It's extraordinary that people like you are creating things like this in times like these. So how did the app get built and in such a short period of time?
That is the beautiful power of collective work and social responsibility. So we had a version of a V1 MVP version from our Shared Harvest Fund when we were rolling out Shared Harvest Fund itself. So we had a vision of how to connect individuals with the need, right? And as this broke out, we just reframe that thought. Instead of individuals will be still the clients or people who are in need of services, but then the nonprofits now on that interface were now our telemedicine partners and telehealth partners, our mental health providers as well. And then we just said, we started thinking about it that, well, what we really need is, you know, a virtual case manager. And that became what our community health partners arm of the app was about. And then we started searching some of the COVID emergency response, and we got in touch with the COVID accelerator, which is a virtual accelerator with so many people, with 600 people. Wow. And we were able to say, hey, we need this, we need that. We got the website up, and then we got the very streamlined version to upload volunteers. And we already had a database of volunteers from Shared Harvest Fund. So we were literally, if you have to think about building blocks and just Legoing it with free services and people who just really believed in what we were doing and was out there to help us. And I think the most important thing about what we built is that it's not the app that's driving us, it's the work on the ground. So our pop-ups have become extremely popular. That's where we drive our customer base, because they come in, they get tested, and then we help them download the app and they download the services, and then we start connecting with them, and we have up to 4 touches in 2 weeks with them already. So I think the fact that our presence in the community, the trust and the trust that we're building, and then the word of mouth is allowing us to continue to build fast.
And I want to make sure I understand the feature set. So I open the app, and I can, in certain cities, I can see where I can go to get tested. I can also connect with the doctor to do a video-based assessment of my condition.
Slightly, a little less than that.
Okay.
Let me see if I can get that. Okay, so what happens when you open up? Oh, I didn't think of putting up the prototype of it. So the way it works is that you open the app, and you can sign up as a volunteer, or you can sign up as a user. When you sign up as a user, then you are matched almost like a Tinder interface to 3 community health partners that are definitely culturally competent, may be in your area close by. So if you're in Detroit and you understand what's going on in Detroit, then you probably want to have a community health partner in Detroit. And then once you identify with them, then there is a video option to have a video session with your community health partner. And that community health partner will then go through the CDC screening tool with you, decide if you need to have COVID testing. Right. If you need to have COVID testing, they will start to text. We will text you all the COVID pop-ups that are available for you to attend. But right now, we haven't built that version of the app where you can just log in and pop up there. That's what we're trying to build. Right now, the interface for that is literally Eventbrite. So once you get the text notification, you go to Eventbrite, you sign up, and then you show up. We test about 100 to 150 people per site location. And the second part of that is that telemedicine piece. So our partners are with Emerge TM. We didn't want to get bulky with the app. So what happens is it becomes a referral service to the telemedicine partners that we're affiliated with. And that also becomes a part of our revenue stream in that with more telemedicine companies are getting a lot of money and resources, they contract with us to get more referral clients.
Hey, Dr. Afominine, it's great to see you, and congratulations on repurposing your technology, so quickly and rapidly towards this, really incredibly urgent need. So I'm on the site right now, and I see that people can donate individually to a neighborhood, right? So literally, I can go donate towards, supporting your services in South Central, right now if I want to. So what are those individual fundraising campaigns going towards, and sort of, and then how do you see testing, being able to expand?
So when you go to the website, I don't know if you want to share your screen, that may be a good way to look at it. But when you go to the website, the different locations within the cities are different parts of the city. So Los Angeles is Culver City, Leimert Park, Inglewood, South Central LA, Watts is included. And what that allows us to do is each test site actually is costs about $15,000, $15,000 to $20,000 to ramp up. And that depends on whether we have full city support in terms of traffic control, and then the total number of testing kits anywhere between 150 to 100 to 150 tests at that time. We're in the process of, the challenge that we had when we were starting up is we're a small shop, unlike hospitals. And so when we buy the testing kits, we don't get the premium pricing. And so as we've been able to scale and pick up more contracts, we've been able to leverage that with our supplier to discount our rates on the testing kits. And so as we get closer, what we love to do is just buy the damn 10,000 and then just keep popping up and not have to worry about negotiating over and over and over again the price, because that's what really causes the variability there.
Got it. And when you're talking about, obviously we're still in a state where we're really under testing.
Exactly.
These numbers are still pretty small. So how are you thinking about making sure those tests are going to, the people that need them most, or that you're testing in a way that's going to most support the community with the numbers being so small?
Right. So one of the key pillars is decentralizing the testing. One of the things that's happening now is you see that in order to get tested, you go through a screening, and then you are tested at a hospital. Very few clinics will do private testing as well. The testing that happens at the health department is referred to Quest. And most importantly, I think that distinguishes us with what's out there is the testing is done through swabs. And although we get the rapid testing done, it's just the point of care. Just recently, they're doing the point of care testing. But what we're testing is the antibody test. We test for when you have it and if you build immunity to it. Because the reason why we're testing is we want to activate the social services in these communities, because that is what the economic downfall for these communities are. When we talk about the coronavirus in general, coronavirus is a community-acquired infection, and therefore it can have a community response to fix it. When you have a community that is empowered to understand exactly whether or not they have it or not, that liberates them to decide how they can help their neighbors. How can they now decide if they want to keep their doors open? And if they do keep their doors open, how do they make other people safe? For those communities who rely on, one of the stories, daycare services and childcare services. For me, it's inconvenient, but I have my kid and I'm like, oh, I'm on a webinar, please, but there's some people can't do anything. They're completely strapped and they're lost their jobs. And so we want to really tap into helping them. The way we do that is we show up in those communities and meet them where they are, as opposed to having them be directed to the hospitals, where we're inundating the hospital between sick and what we call the walking wounded, which compromises the healthcare system. There's so much money that's going into ventilators and focused on the critical care patients, but the mass losses are actually happening in the communities where we're not counting people.
One suggestion, I think what you need most is funding and also awareness. And it seems that one way to try to bridge both those challenges is through the government. And I'm just wondering if you've tried to, either through Twitter or through your network or somehow, basically to get in the ear of, you know, the person preparing the notes for Governor Cuomo's daily press conferences, the person, you know, prepping Gavin Newsom, whatever. Like, you just need like a couple mentions in a couple of those high profile places. And then the real like moonshot would be to get some funding buried in the next $1 trillion stimulus package that, you know, the House and the Senate pass, to try to get, you know, 500,000 or $1 million out of something like that. And the way to do that is to find the right lobbyist or the right person, who basically pro bono is going to try to help make that happen for you, and, you know, get that in the right person's inbox and in the right person's ear over the next, I don't know, 4 weeks. I don't know how to do that. But
Call to action. Well, I have to say, our first location in Culver City, the reason why we did go there, because we received a lot of love and support from the city of Culver City. The previous mayor, Thomas Small, was very much influential in getting us into the right places, in front of the right people for even our first set of angel donors. And Joanne Brody, who is a PR genius, has been working her engine around that. But you're absolutely right. And, you know, it's very difficult, especially as you're a clinician. You are used to focusing on the front line. And there is that media piece. We have been on CNBC. I just got a recent, literally during this conversation, a call about CNN may want to have something to do with us, and that we just got another site. So I think it's the word of mouth, definitely. But, you know, it's also the challenge of being a founder and wearing multiple hats, not knowing where the focus is, and you focus on what you're good at, which is being on the front line.
Well, thank you so much. I really, really amazing stuff that you're doing here, and I hope that that some in our audience as well, you know, can think of ways to support your mission, because you're really doing some great stuff. One thing I'm noticing from the chat, something called opengrants.io may be of use. But yeah, if anyone out there watching this, you know, knows of additional ways to, you know, get attention and support for what Dr. Fominan is doing, yeah, that would be really phenomenal. So I wanted to thank everyone for attending our first ever virtual pitch showcase. I especially want to thank Anna Barber for joining us as our external judge, and of course my co-founder Spencer. And also Dr. Fominan, Celine, and Bentley. Really appreciate your time. We very much support what you're doing, and we will post, we'll follow up for all the attendees on Zoom over email, but also we will post a video of this pitch showcase on dot.LA, and include contact information for anything, for anything that you want to do for follow up with any of these three really exciting companies that all do very different stuff, but are you know, in different ways, trying to make the world a better place in the strange new world that we live in. So with that, I wanted to thank everyone for coming. I wanted to encourage you to, if you're not already signed up for .LA's newsletter, go to dot.LA, sign up. It's, you know, I think we're doing pretty good stuff that will be of value to you if you enjoyed what you just saw. And we are doing weekly events. Tuesday morning strategy sessions have been really great, and we hope to do more of these soon. So stay tuned, and thank you so much for coming. But have a great rest of your week. Bye.
Thank you.